guys, welcome back to another episode of Grow RDH podcast. My name is Katie and I'm your host. I'm a dental hygienist from South Dakota, and today we're going to talk about obesity and perio. This is following the trend of perio. We've been talking about perio for, almost 2 months now, and we're going to end this perio sequence, with 2 episodes. So today we're going to talk about obesity and what the research says, why it's important to our patients. And then next week, we're going to be talking a little bit about how to approach patients about perio and obesity, specifically how to approach patients on difficult topics, some things that are just harder to talk about. But I want to talk today about why it's important. And so I am sitting outside today. It's super warm and my kids are home and it's really, really hot. I think we're going to go to the pool later, but for now they're cooling off inside, and I just took the shade and I'm going to sit out here for a while and just enjoy the shade. Hopefully it's not too distracting. I know there's some noises, some birds, hopefully no wind sounds, but I just had to enjoy the deck for a little bit. So so let's just get right into it. Many factors we know impact perio, right? And that has to do with the systemic nature of chronic inflammation and host response. The way that our bodies fight off infection or fight off disease is entirely based on our immunity and our immune response and how well our bodies are functioning. And I think it's just becoming more mainstream now. Everybody's talking about perio, and that's great. We want that. That's our goal, right? But many different factors can impact how patients respond. One, to how they respond to therapy. So during periodontal therapy and immediately after, how they heal, how quickly they heal, what type of healing they get, and then the maintenance too, right? So we get them into a maintenance cycle. How they respond to continual maintenance appointments is all impacted by tons of different factors, because tons of different factors impact our body's host response. So one of those factors is obesity. And what I've found is that in the dental community in general, it's difficult to sort of cross barriers, right? And talking to patients about harder things, if we are going to be recognized as primary care providers, we need to have some conversations with patients that maybe aren't quite as easy. And I'm just going to use blood pressure as an example. Even when we take blood pressure, so I take blood pressures before I give anesthetic, and that even makes patients question, like, why are you taking my blood pressure? Why is this important? How do you even know how to take a blood pressure? So things like that, like, people just don't see dental providers as overall wellness providers. And so I think that's hard. Because I think as dental providers, new territory is scary and weight is difficult to talk about. So today, I really want to focus this episode on why it's important, what the research actually says, and then next week, I want to cover how to professionally do it, and we're going to talk about body mass index and why that's controversial. So that'll come next week. So tune in next week for a follow-up to this episode. But today, we're going to focus on the research. And I want to start by saying I found 4 really good articles that are all open access. I will link the articles in the description so you can, wherever you're watching, Spotify or YouTube, you can just click the link and read the article yourself. And I highly, highly recommend that. Again, there's a lot of information in one single research study, right? So when I'm summarizing these articles, I'm basically just giving you the main points and the highlights, the highlight reel. And that's why I'm going to link them, because I really think it's important that you guys read them so you know what they're actually saying and you can make a really educated opinion based on all of the research. So there are all open access articles. And I pulled them together because collectively they sort of paint this picture of why obesity is such an issue with perio. And I think it depicts why we really should be asking our patients about their weight. And there are tactful and professional ways to do it, and then there's subjective and not very professional ways to do it. And so we're just going to summarize the articles, and you can make a really good decision for yourself and your practice about how you want to incorporate this information. So the first article I want to mention is a systematic review. And so back in 2014, there was a big systematic review done, and it was correlated, associated, that high BMI and perio are linked. And basically what this systematic review, so Kim et al., there's a bunch of authors on this one. I'll link it below. Kim et al., this is from 2022. And it basically looked at all of the articles from 2014, and then it looked at a bunch of new articles, and it basically just confirmed what they found in 2014. And they said, yes, this is correlated. They don't know necessarily what the cause and association is, but they are linked, right? And so they just confirmed that all the research that we've been doing is important and is relevant and necessary. And it's a great place to start. I think if you're just sort of dipping your toe into the world of obesity, I think systematic reviews are a great place to start, because in that reference list, you are going to have hundreds of articles that are directly related to the topic. And you can prioritize them by year. You can go back and read those individual articles. But yeah, please start there. It's a great place to start. I think you should check it out. Then next, we're going to talk about 3 empirical articles. So the empirical articles are original research, not systematic reviews where you pull a bunch of research and clump it all together. This is empirical research or original research done on perio and obesity. And so there's 3 of them. The first one I want to start with is an article by Anderson and Ham, and this is from 2015. This is not a dental related article in general, okay? But it highlights why wound healing is harder for obese patients. And it all has to do with managing individual factors for each patient, right? We know that patients that have chronic inflammation struggle with immune response. We know that just from our textbooks, how we are trained. We know that and understand that. But what this article did was highlight the factors that are specifically causing issues for obese patients. And so as providers, it's our responsibility to manage those individual factors and seek those out for each patient depending on what their individualized needs are. So here are a list of some of the individualized factors that this original research found. So it can include comorbidities such as diabetes, obesity, protein, energy, and malnutrition. It can also include medications such as steroids, NSAIDs, and anti-rejection drugs. It has to do with oncology interventions such as radiation or chemotherapy. And then finally, it has to do with lifestyle habits such as smoking and alcohol abuse. So again, just solidifying the fact that it is so important to individualize your care. And if you have an obese patient, asking or screening for those individual factors is going to help you understand what the patient's struggles with inflammation really are. Second article that I have for you is an article by Kaye et al. I hope I'm saying that right. Kaye et al. From 2023. And this article describes how obesity increases the treatment intensity for periodontal therapy. This finding is supported by obese patients requiring increased medical treatment in a lot of different medical fields. And so basically, to summarize, what this article discusses is that in general, so in the broad scheme of things, in the broad medical sense, obese patients seek out seek out care from medical providers more often. And so they looked into how that translates to dental and found the same thing. Obese patients seek out or need or are required to get periodontal therapy a lot more than healthy weight patients are. So that means that there's a need, right? It's not like cause effect type of relationship, but it is important in helping to sort of highlight the correlation there. And then finally, the third article, I'm just going to mute my phone. Sorry, I'm having text messages come through. I'm not sure if you can hear that. The third is an article by Rahman et al. And this is from 2023 as well. And this article I found super interesting. This was my favorite article out of the whole bunch that I was looking at. And that's why I wanted to end on it, because I thought you guys probably would like it too. So what it did was it looked at the microbiome of the mouth, the oral flora, and to look to see if there was any indication into what types of bacteria are found more often in different types of patients. And so, so all of their findings, they did a couple different sects, I guess, or groups. And so I want to talk about, you can, again, read the article. It's good to read the whole article. But what I want to talk about is they did a portion of the group with patients with moderate to severe perio. And then within that group, they looked at patients that were healthy weight, that were overweight, and then that were obese based on body mass index. So these are their findings. For patients that were obese, they had an abundance of Agaricobacter actinomycetum comitans. That's a mouthful, sorry. I did practice that before I came on, but it always just trips me up, especially when I'm recording. Overweight patients had an abundance of Tannerella forsythia and Treponema denticola. So that was the overweight group. And then healthy weight patients had an abundance of Porphyromonas gingivalis and Fusobacterium nucleatum. So P. gingivalis, we know, is associated with a lot of chronic gingivitis cases. But AA, that is associated in obese patients, is highly associated with the most aggressive forms of perio. And we all know that, right? So to know that obese patients have more prevalent population of AA is really significant. That tells us a lot. So they also found that the dysbiosis of the microbiome was correlated for body mass index and severity of perio, which makes sense because if you look at the bacteria, AA, that's one of the more aggressive forms, the correlation between BMI and severity of perio was there in this article. And I just think that's so significant. I think it's really important to talk about. It's really important to screen for. And I know a lot of people have some differing opinions about diagnostic testing or bacterial testing. Some people just really are on the fence for it's unnecessary. It doesn't matter. The infection is there and we're treating the infection as a whole. And some people are on the fence of like, these aggressive bacteria really do make a difference. And so wherever you are on that spectrum, this finding still is significant because it tells us that it really does matter. BMIs can influence somehow. We don't know the link yet, right? We need more research. If you're out there doing research, go you. But we need to investigate that association or highlight that association and educate our patients about that association. How can we disrupt that biofilm more often? How can we reduce the amount of those really pathogenic bacteria in the mouth, maybe through probiotics, maybe through using some sort of irrigation tool because we know irrigation gets to the depths of those pockets, right? It doesn't matter how you're irrigating as long as you are irrigating. And if you're irrigating, you are getting deeper than any other oral physiotherapy aid, right? So we all know that, but for these patients, it's really, really more important to educate them on that importance. So I guess I just think that finding is so interesting because healthy oral flora is so important in maintaining homeostasis, in reducing chronic inflammation, just overall having a healthy microbiome is really important. So that is all of the information I have for you today. This is a nice and short one. I want to include, and I separated them into 2 different episodes because I want to include patient communication techniques surrounding obesity. And I also want to address BMI because I am anticipating that is sort of the holdup. A lot of people don't like BMI. They think it's flawed, which I'm not saying it's not. It's definitely, it's one of the things we have to measure. And so that's what we're going to talk about next week. But I knew that was going to be a whole big, long conversation in itself. And I didn't think that I would have time to cover both. So in the meantime, if you're going to tune in next week, in the meantime, read the articles that I have linked. I think it will really help you sort of get in the mindset of talking to patients about obesity. Give me some feedback. Reach out to me if you are already successfully educating patients and discussing healthy weights. Reach out. I would love to hear some success stories about this topic. I think when we can hear from other hygienists that are successfully doing things well or having really good feedback from that, that is so helpful. That is more helpful than any CE course that you're ever going to go to. So please reach out. I would love to share stories of success or stories of encouragement for how we can talk to patients about some of these sort of controversial topics. So please reach out to me if you have any stories to share. If you have any questions or have anything that you want me to address next episode when we talk about how to talk to patients about obesity, I would love to hear it. You can email me at katie@growrdh.org and I will be there. So until next week, I hope you guys are having a great summer. I hope you're enjoying the weather. And hopefully there wasn't enough bird sounds in my background to be distracting. But again, I just had to sit outside. It's nice out and I had to enjoy the deck a little bit. So, all right, I will see you next Friday. Have a great rest of the weekend. Bye.